Protect your DNA. BioPQQ can promote formation of new mitochondria. Infowarsstore.com.
Leanne McAdoo reporting for Infowars.com. We've got some breaking news. New York and New Jersey have just implemented a mandatory 21-day quarantine for anyone that is flying in from the affected Ebola zone there in West Africa. Now, the governors, they both say that this is too serious a situation to leave to the honor system, and they are basically going above and beyond the guidelines that have been established by the federal government. They're taking it into their own hands. They're saying we are well within our legal rights to enforce this mandatory quarantine. One woman has actually already been put into quarantine. She was a healthcare worker, and initially she wasn't showing any symptoms of Ebola when she landed at Newark, but she was placed in an isolation at University Hospital in Newark, and it was there by Friday evening that she did start developing these symptoms. So this is what we're saying. That initial temperature taking with the enhanced screening that they're doing at some of these other airports aren't going to be enough. Here, she would have been let through, but because she was put in this isolation unit, she started developing a fever, and now she's going to be moved on to these government facilities. And that's basically where they're going to be putting this mandatory quarantine, at government supervised facilities. So no word yet, are these FEMA camps? FEMA really isn't, it's not really authorized by the federal government at this point. New York and New Jersey are saying that they're well within their legal rights to begin doing this. They're saying voluntary quarantine is an oxymoron. You can't trust people to put themselves in a mandatory 21-day quarantine, just like we saw with the chief medical correspondent there at NBC. She stepped out to get some soup. Of course, then we had Dr. Spencer, who decided to go bowling, even though he had been in direct contact with people he was treating there with Ebola. So even he couldn't last the full 21 days quarantine. So now they are basically establishing their own mandatory 21-day quarantine at a government-supervised facility. No word yet where this is going to be. Basically, they're saying that the quarantine and hospitalization is going to be determined by health departments in New York and New Jersey. More updates on that as they come in. But people are basically, they've been asking for this 21-day quarantine. We know just several months ago, Obama did reissue that executive power that allows states to do this mandatory quarantine for people who are just exhibiting Ebola-like symptoms. It could even be flu-like symptoms. So here we have people that are going to be brought in. Now, initially they say it's going to be the patients with the highest level of possible exposure. They're going to be automatically quarantined for 21 days at these government-regulated facilities. It includes any patients who've had direct contact with a person who's infected with Ebola. Lower risk patients are still going to be monitored just for their temperature and those symptoms as well. So we see the voluntary quarantine isn't working. It was a big joke today at the House Committee on the Ebola response. People were just stuttering and stammering, saying our procedures are very effective. The CDC, they weren't forthcoming with their proof. And so now we have the governors of New York and New Jersey taking it into their own hands, enforcing a mandatory 21-day quarantine. So it has definitely ramped up a bit. It seems like it's not just going above and beyond and just really trying to show the utmost care. They're saying, no, we're going to go ahead and keep you guys quarantined at these government supervised facilities. So we're going to keep you updated on this as this story breaks more over the weekend, get a little bit more information for you. So stay tuned to Infowars.com. We'll bring you the news as it's breaking. I'm Leanne McAdoo.